Hiya, I'm Dr. Trevor. So today I'm going to share about the experience of the dental training program. So thanks to Friends of Nixon to make this possible. So the reason why we conduct this program is because in the past few months, we have seen a lot of patients who came in with dental abscess. So this is because uh, there's no dentist in Shea Burma and they never see a dentist in their life before. So as you can see in the left, this patient actually uh, he was having 3 dental caries, and these 3 dental caries, these 3 tooth decay uh, leads to a very serious infection. So you can see this abnormal swelling over the face is all because of these dental caries. So the same thing in the right. So this is actually very serious because I have not seen any dental abscess in my life before, not until I went to Sierra Leone. So, but the problem of this uh, is because uh, there's no dentist in Sebrema, and they need to go to the nearest town, uh, which is Kenema, and it's about 30 miles from Sebrema. And it's a 1 hour journey from Sebrema to Kenema, and it costs them 3 GPD pounds uh, for return. And if you want to remove a tooth, it the price is £7 for one. So no one in Sebrema can afford this price. So that's why they decided not to deal with the dental caries, and which leads to serious and very severe infection, which caused the dental abscess you have seen in the last pictures. So according to the case report in Sierra Leone, actually uh, the mortality rate of this dental abscess is about 45%. 45%, which means 1 in 2 patients will die because of this dental abscess because they couldn't afford to see a dentist and they couldn't remove the dental caries, which leads to a life-threatening infection. And as you can see, the median age of these patients is 28 years old, which means these patients, they are the financial support of the family. So when a patient passes away because of dental caries, so the whole family usually will collapse. And actually, this is very sad because I wouldn't imagine this kind of things happen in the world, in any place of the world, just because of dental caries, because of the limitation, they couldn't access to the dental service. So initially, I, I didn't know what to do with this problem. Not until I share our volunteer opportunity on Facebook, and then someone suggests me to um, to connect with another NGO, which is which is called Oral Health Africa Initiative, and which is based in Nigeria. So I wrote an email to them, And then luckily they replied, and then we had a discussion, and then they decided this is really very this is a very urgent situation, and they have agreed to come to help us. So, but we still need the dental instrument. So I try to communicate with my friends in Taiwan, and then they were also very helpful, and then they sent some dental instruments from Taiwan to Sierra Leone, which we have injector, cartridge, elevator, and forceps, which is the basic instrument you need to remove dental caries. But because they are only here for 1 week, so we need to make use of their time. So I decided to create a dental training handbook and then try to teach them on the theories so that when the dentists come, we can start the practical training. So and this handbook we can also use in the future to train the others to remove dental caries. So the QR code in the left side is the handbook, and the QR code in the right side is the video I've made to train the others. So after 4 days of the lecture, uh, there was a and there was an exam in the last day of the training, and they did well in the training and in the exam. So this uh, they are all our medical staff, and they are the main target for this dental training. So uh, actually we have two doctors. So Dr. Misa, and this is our new local doctor, Dr. Yusu James. And we have one community health workers. So this is our Sajo, our surgical assistant community health officer. And these three, they are all our nurses. But before that, we need to make sure that um, the patients in the villages who want to see a dentist, they will come during the dental training program. So we decided to go on radio for community sensitization. So in Sebulba area, actually we have 10 peripheral health units, which is marked as the yellow star on the map. And the green star is our hospital, Nixon Hospital. So in the peripheral health unit, we have community health workers. So we ask the community health workers to help us to screen for the patients and for the registration for the patient who wants to come to see a dentist according to the dental service schedule. However, it turns out the dental condition is even worse than we could imagine. So initially, uh, we, we, we were planning to have an outreach on Saturday, but we decided to cancel the outreach and then to continue providing the dental service. Uh, and then, so on the first day, they arrived on the Sunday. We started the dental training program. And then we also see some patients in the ward with the dentist because we were having a patient with dental abscess and the other patients with the retained root. So in the whole dental training program, we have seen 100 patients and all of them came with very serious dental condition. So as you can see, all these is the dental caries and retained root, and they all look very terrible. And that's why we spend more time that mm, we imagine on one patient because the condition was too terrible. So during the whole dental training program, we focus on treatment and techniques. So the first thing we concentrate on training, the first thing we focus on is the scaling and polishing because we know that scaling actually is the very basic technique in dental service. We need to clean the tooth so that there will be no calculus, uh, which may lead to periodontitis or any dental caries in the future. So we use the dental ultrasonic scaler provided by the Oral Health Africa Initiative. And then we also do uh, temporary and permanent filling with the use of LED light lamp machine. And of course, we also perform the tooth extraction for dental caries and retained root. So these are some of the pictures during the dental training program. So as you can see, uh, this is Dr. Karim, and he was trying to uh, demonstrate how to remove dental caries. And then this is Dr. Timothy, who was trying to teach Asna to our CHO how to do the scaling and polishing. And this is another picture of Dr. Karim trying to teach Dr. Mesa how to perform scaling and polishing. And during the dental training program, there were some of the patients who came with dental abscess. So we perform the tooth extraction after giving some injection antibiotic to solve this problem. Otherwise, if this left untreated, it will become a very serious infection as you have seen in the previous slides. So after a few days of the training, so our nurses were able to perform basic uh, basic dental services like scaling and polishing. So I'm going to play some video. So this is the video. This is Dr. Misa, and Dr. Misa is performing scaling and polishing all alone by himself. And then this is one of our nurses who also perform the scaling and polishing. And then this is our Sasho, our community health officer, who is performing the scaling and polishing by herself. And this is Dr. Karim, who was trying to teach Dr. Misa how to perform the local anesthetic. And then this is Dr. Timothy, who was trying to teach Dr. Jusu James how to perform the local anesthetic. So other than the dental training, they also teach the patients how to brush the teeth properly. And then back to our slide. So as you can see, after this dental training program, all of our medical staff were able to perform the dental technique by themselves. So after this, Dr. Jusu James and Dr. Misal, they all received the certificate by the dentist from Oral Health Africa Initiative as a proof that they can perform the advanced dental technique by themselves. And these are the photos that they were doing the health promotion, trying to teach them, trying to teach the patients how to brush the teeth. And they also provided toothbrush and the toothpaste to the patients. And thanks to Friends of Nissan and thanks to you that who donate generously to make this happen. God bless you. So they also provide us an award for appreciations to Friends of Nixon. And this is me. But after this dental training program, is this happy ending? There are still some limitations. So some of the machine they brought, they didn't live with us. So actually, currently at the moment, there's no dental ultrasonic scaler in our hospital, and there's no LED light lamp machine. So actually, currently we couldn't perform scaling and polishing, and also we couldn't perform the permanent filling. We have some basic dental instruments for the tooth extraction. However, there's no dental chair at the moment. So as you can see, actually, we were having difficulty performing the tooth extraction because we don't have a proper dental chair. And so actually, we need more help so that we can help the people in Shebema to receive a basic care as a human. So as a human, we should actually access to the medical service as human rights. Thank you.